Alright, so let us begin with Ellen Skinner's study streak, or rather, let us continue. We have discussed a few remedies for the female reproductive system, and we are discussing remedies which are hemorrhagic in nature. And we discussed last remedy was hemamelis. So now continuing that, hemorrhagic remedy study from Allen's keynotes, we come to the remedy crotalus horridus and naja, which are very interesting remedies from the snake kingdom. So the first remedy, crotalus horridus, let us go over through it from Allen's keynotes. It is indicated in strumous, debilitated, hemorrhagic, broken down constitutions during zymotic diseases and in inebriates. So by these words itself, you should be able to understand what it actually acts on and how will it act. The first thing is it is indicated in broken down and debilitated and hemorrhagic patients. Those who have bleeding from their, due to disease conditions, those who have some hemorrhagic diathesis, on and off there is bleeding. Either it can be vicarious menstruation, it can be vicarious bleeding, it can be epistaxis, recurrent epistaxis, or it can be small injuries which cause frequent bleeding. Those are the conditions that will predispose for you to prescribe crotalus horridus. Next we have zymotic diseases. This is something which has dragged the patient to a large extent, especially at the level of blood and circulation, and caused the destruction of RBCs or blood corpuscles in some way, which has made the patient debilitated. So there are remedies which work on the circulation of blood. There are remedies which will work on the coats of the blood vessels. There are remedies which will work even superficial on the exchange mechanism of the ions, sodium, potassium salts. Once you know those remedies, it becomes a very easy prescription when patient presents with those conditions, whether you need to give them something that is deficient in sodium or potassium level at the level of ions or cations, or something that is a destruction that is happening inside the blood vessels, or something that is happening inside the circulation, or even more, there is some destruction or disturbance in the nervous system or the pathway of the nervous system. You have to understand those pathologies, you have to match the same pathologies with the remedies that are there in our materia medica, and it becomes a very easy job once you do that. So if you are in touch with me through my sessions, you will learn all about these different ideas and newer things that will come up and make your prescriptions easier and help you prescribe on the level of pathology very easily and hit them hard, so that the disease has annihilated right from the beginning. So crotalus horridus, hemorrhagic diathesis, broken down constitutions, and zymotic diseases, we read something that destroys the blood. And the last line is inebriates, those who are chronic alcoholics, their blood is rendered changed composition, and also their tissues are very much broken down to the thinnest of their matter. Those cases will require crotalus horridus. Diseases caused by previous low state of the system, low septic, typhoid, malarial fever, chronic alcoholism, exhausted vital force, and genuine collapse. So all the people who come and tell you that I have had typhoid 4 times, 3 times, there was nothing conclusive that was happening from the allopathic medicines, and again I keep getting these gastric infections and I don't know how do I overcome. The problem is in the soil, and the problem is that the Salmonella typhi is still harboring in their gastrointestinal tract, especially the small intestine, where it is doing the damage by whatever food is entering. Crotalus horridus will probably set them right, and then you will need to give them also doses of carbovage or some other indicated deep acting antisoric medicines. Next you have for crotalus horridus, hemorrhagic diathesis, blood flows from eyes, ears, nose, every orifice of the body In fact, the sweat is also bloody in nature. Next we have is prostration of the vital force. Pulse is scarcely felt and there is blood poisoning. Pyrogen is one of the top remedies we think of. Crotalus horridus is another remedy we can think of. Bad effects of vaccination, there are too many remedies, but what happens after vaccination, if we catch those points, those indications and prescribe, our life will be easier than just giving everyone thuja or cilicia. That's the wrong concept actually which we develop. Yellow color of the conjunctiva clears up after keratitis or keratoieritis. All deep seated conditions which have the involvement of blood or the blood destruction or the vessels which have been destroyed, they will find their good result from Crotalus horridus. So you should think of this remedy, interesting remedy. And you see that the tongue is also matching that of pyrogen, which is heavily indented and fiery red, smooth, polished, as if all the blood is concentrated on the tongue itself. It is engorged. Next you have is malignant diphtheria in Crotalus horridus or scarlatina, edema or gangrene of fauces or tonsils. Pain aggravates from empty swallowing if vomiting or diarrhea come on. So, as I told earlier also, there will be patients who will tell you that they have had typhoid or any viral conditions that keep coming to them and attacking them every few weeks, every few months, every year. Those are the conditions that predispose you to think of remedies which will eradicate those problems which are harboring in the intestines or the respiratory tract. If it is the intestines and if it is again and again troubling them, then you should think of Crotalus horridus. It is going to kill those pathogens that are involved for conditions that create again and again the illnesses which deteriorate the patient. Next you have is vomiting, bilious with anxiety, weak pulse every month after menstruation, cannot lie on the right side or back without instantly producing dark green vomiting, black or coffee grounds of yellow fever. African continents, if you get to know about these conditions, yellow fever, or even in India, the marshy areas, especially the eastern side, Kolkata, Orissa, you will find these conditions where the patients are affected by fever again and again because of a trait of a mosquito. Those will be the ones they will require Crotalus horridus. You will also have in Crotalus diarrhea, which is blackish in nature. Very rarely patients will tell you, but if you hit it once in your life, then you will get to know how and when to give Crotalus horridus. It is like coffee grounds, dark black blood. We saw that in Hemamelis also there was dark black blood, and in Crotalus horridus also there is dark coffee ground like diarrhea. It is offensive also in nature. Septic matters in food and drinks are causing the issues in Crotalus horridus. And if they are chronic alcoholic, they are tend to get these problems and keep on repeatedly having it again and again, like the remedic pyrogen. So we give pyrogen to many patients in and out where there are septic conditions, infections happening. Give a thought to Crotalus horridus, perhaps that will remove the tendency also in a similar way like pyrogen does. During yellow fever, cholera, typhoid, typhus, Crotalus horridus can be thought of as an intercurrent remedy or as a remedy as a similimum to be thought of in such cases. If you have a case which has deteriorated and there is destruction that has happened, for example intestinal hemorrhage, and it happens in septic or zymotic disease, blood is dark, fluid, non-coagulable, think of Crotalus horridus. The jaundice which is there in Crotalus horridus is of a malignant type, hemorrhagic in nature rather than hepatic. So you will see that there is lot of destruction that has happened in the CBC report, complete blood count, and the bilirubin has fluctuated also, but the destruction of red blood corpuscles and the other parameters of complete blood count will point you to think about The jaundice being hemorrhagic in nature, think about Crotalus horridus, and a few doses will bring them back on track. Get the CBC or the reports done maybe in 24 or 48 hours to monitor the patient, and you will get access to how the patient heals immediately after giving a few doses of medicine. Next, you have purpura hemorrhagica, comes on suddenly from all orifices, skin, nails, and gums. So everywhere there is destruction, everywhere there is bleeding. That's what the presentation will be. Maybe this will be a condition of a patient in ICU or someone who is about to land in ICU, and that time you should think of this remedy, as well as you can think of some acids which will be indicated. It can be muriatic acid, it can be those difficult phosphoric acid cases also. Apoplexy, those patients who are predisposed to stroke and they get stroke again and again. I had one case, but she improved on lorocerasus. Crotalus horridus can be thought if there have been hemorrhagic diathesis as a repeated episodes which you keep seeing. Apoplectic convulsions happen in Crotalus horridus patients, especially if they are alcoholics and they are not having strong constitutions which cause them to get this trouble again and again. Vicarious menstruation, we saw this in the Crotalus horridus remedy right from the beginning. Everywhere it is happening again and again, and again here it is a similar remedy. Crotalus is a similar remedy like digitalis and phosphorus. Menopause, there is intense and drenching perspirations, faintness, sinking at stomach, and this was a similar case with trillium pendulum. But over here, there the bleeding is bright red, here the bleeding is dark, offensive, and there is anemia which is to a large extent seen. Patient will complain of weakness, you get them checked, and we'll get that there is lot of anemia that is happening, or it's going on, the counts have reduced. Malignant diseases of uterus, great tendency to hemorrhage, blood is dark, fluid, and offensive. So all those cases which have fibroids, and then there are cases which have multiple fibroids, and then there are cases which have fibroids as an extension to the surrounding organs, PID, those can be given a thought for Crotalus horridus. In the skin we have dissecting wounds, insect stings, those people who are practicing in rural areas and you think that insect bites are common, scorpion bites are common, snake bites are common, Crotalus horridus can be thought. Also, Crotalus horridus is similar to tarantula and anthracinum in tendency to carbuncles or blood boils. You can compare this remedy or think about this remedy which is similar to elapse, lachesis, naja, and pyrogen. So all those cases where you are giving pyrogen, where you are thinking of blood disorders or something that has destroyed the blood, think of all the snake remedies and think of pyrogen. The major difference between Crotalus and lachesis, which is also another remedy we can always compare with, lachesis will have cold and clammy. Clammy means that there is more of a wet nature of the perspiration, cold and clammy skin, like Calcarea carb actually. But Crotalus horridus will just have cold and dry skin rather than the wetness which we see in lachesis. And right lung affections or expectoration of black blood will point you to Crotalus horridus and elapse also as one of the differential remedies. Next you have a similar remedy which is a very small remedy in Allen's keynotes, but one of the top remedies for Kent, because he says that every human on earth may require this remedy at one point of time. The remedy is naja. So when you read naja, it's a very small remedy from Allen's keynotes, maybe just half a page. There is one very strong thing which is present, and this should point you to think about this remedy. The first thing is that it has suicidal insanity, but what comes next is even more importance, because many patients may not exhibit suicidal insanity. The words that are important is that broods constantly over imaginary troubles, and if you understand this line, you're going to solve many cases of naja in your clinic. And how is it? Many times patients feel that they have some problem and that it is belonging to a pathology which is very grave. They keep on thinking and they keep on thinking about it again and again and again, every day, every night. This will be a scenario for a case which has fixed ideas, broods constantly over imaginary troubles. Even though their problem is functional or not even existing, they'll keep on thinking 100 times, 1000 times over it. And along with this, they will have some blood related or circulatory disorder which would point probably to hypertension or something which is varicose veins in nature. That should be your grounds for prescribing naja tripudens. Simple hypertrophy of heart, restoring a heart damaged by acute inflammation, all those cases with COVID which had the heart attacks or heart attack like symptoms but the heart did not get attacked actually, they should be given this remedy. Also those cases who have single pinpoint pains and you get their 2D echo done of the heart, it will point to some valvular conditions. Naja given in few doses every few days will probably relieve and help most of the, I would say 80 to 90% of the valvular troubles, chronic hypertrophy of the heart. Left ventricular hypertrophy with valvular trouble should point to naja tripudens. Look no beyond, and you will have some sort of cough which kind of irritates the patient as an acute stage of rheumatic carditis or chronic organic lesions. So you will see that the patient has a borderline hypertension, some sort of heart pain or pain in the chest region in a single point. Most of these single point pains are also valvular related troubles. If you get them checked up, 2D echo will show some damages, they will have some sort of cough. This will progress to chronic joint pains if they are not treated well, and also chronic heart troubles. It can be a combination of rheumatic heart disease. That should be your way to think for naja tripudens to prescribe. Threatened paralysis of the heart or post-diphtheritic paralysis. Pulse is irregular in force but regular in rhythm. Now this is difficult to explain in words, but if you have checked pulse of each patient, then you will be able to detect it very easily. Inability to speak with choking, nervous, chronic palpitation, especially after public speaking. Pain is aggravated by carriage riding or lying on one side. Severe stitching pain in the region of the heart. Many times patients will tell you, and I already told you in the beginning, where you need to prescribe naja, and you can compare, when you compare this remedy with arsenic, cactus, crotalus horridus, lachesis, mygale and spigelia, you see that there is a remedy which is fastidious in nature, fearful about what problems he is having. The other remedies are hemorrhagic in nature, crotalus horridus and lachesis. And then there is a remedy which is specifically acting on the heart, cactus and spigelia. Those should be thought when you have to prescribe naja, or whenever you think of these remedies individually, you can think of naja as one of the remedies which has the combination of all these things, or more or less symptoms which have one symptom from each of these remedies. That should be a combination which you should look out for to prescribe naja. So that's all for today's session on crotalus horridus and naja tripudens, and we'll meet up tomorrow again with next set of remedies from Island's keynotes. We have been doing this from the month of June, and probably only a few metals and acids are remaining and the bowel no swords, and we'll finish soon, probably in this month or early next month. And if you have been going along reading Ellen's keynotes along with the session or after the session as a recording you are watching, this is going to help you to prescribe quickly in your practice, and give you the confidence that is much needed when you have a patient where you need to decide on a remedy. So that's all from today's session, and stay tuned for the next one.